everyone. My name is Sadia and I'm a consultant cardiologist in Chelsea and Westminster Hospital in London. I'm really pleased and delighted to share with you our experience of working with the GE Portrait mobile system today. Just before I start, I'd just like to go over my conflicts of interest. So I'm privileged and I have a research role with Imperial College in London. And as part of that, in my NHS role, I've done a significant number of studies and research work on remote monitoring and sensing systems. And we were one of the first teams to be able to work with the Portrait system, which I'd like to share that experience with you today. So before I start talking to you about the GE Portrait mobile system, I'd like to give you an introduction to the part of the world that I'm sat in. So I'm in London, which is a fairly large city, and we're in the dark blue spot in the corner in Hounslow. We're a fairly diverse community. We serve around 1 million people between the two sites of the hospital, and you can see the front doorway to our services here on this picture. Why did we start looking at portable monitoring systems and remote monitoring systems? And it really stems from some work we did both around the quality of care that we provide, but also about some research work that we were started to be interested in because we were looking at trying to improve the clinical outcomes for the patients on our general wards, particularly those who were admitted with general medical and general surgical problems, and trying to look to see how we could improve the care that we offered. And what we realised was that in line with sort of national and international literature, we recognise about 15% of people will deteriorate, and that we recognise that deterioration. Those are the people that you can see coloured in red and deep amber on this pie chart. But we found there was a significant other group, almost half of patients, where there were deterioration that we weren't picking up, and therefore we were really interested in understanding how we could try and pick these patients up better. And it wasn't as if we weren't already collecting data about them. We were collecting an awful lot of data. So we had demographic data that we were collecting from our admission records. We're collecting medical history. We're collecting routine observations. We're collecting blood tests. And we're trying to understand, particularly because we were interested in sepsis, we were looking at infection sources and antibiotics and what kind of tests we could do. But we realised that there was something missing. And what was missing was that direct patient data that was coming from observations that were more frequent. And that's where we really started to be interested in the Portrait system. And this is one of the first patients on our wards who wore the system, together with one of my coronary care unit nurses, where we first started to trial it. And what you can see are very portable and lightweight sensors. The ECG dots are here because the patient's on a cardiology ward and aren't part of the system itself, so you can ignore them. But you can see how small that system actually is. So we're really interested in what I'm really going to focus on presenting today is what the patient and staff perspective on this is. We asked our patients what they thought about sensing technology and what they thought about systems like this. And you can see that the key themes that were emerging were really around the comfort and usability of monitoring, the perspective around safety and what the future would hold, and the real acceptance of technology such as this, but also a real patient awareness of the burden on healthcare staff. And I say this to my medical colleagues, that actually the patients were really worried about the nursing staff in particular, and I can fully understand why. No one was that interested in the medical staff. And with respect to the Portrait system in particular, you can see here some collated and summarised feedback of what the patients had to say, but also some direct quotes that really, I think, highlight the value that patients place on technology such as this, but also the direct link they make between care, human care, and the technology-enabled care. It's not just patients. I think the pandemic phase has made it really clear to us that staff experience and patient experience are two sides of the same coin, and both need to work hand in hand. So we asked the staff what they thought about this as well. And these are in the same sort of thematic analysis. They give us some information about the staff perspective. And what's very clear is that there's a huge overlap between the themes that the patients identified and those that the staff identified. So there was a real clear understanding that technology such as this appears to be the future of healthcare. There was an understanding that actually there are problems with the way we currently do things, and there was a real focus on patient safety and the impact and on improving quality of care that technology such as this can provide. So from the staff feedback, we asked very similar questions around the technology to staff. And again, you can see that in terms of the staff feedback on this particular system, that it was actually very positive. I too agree and think that very much technologies such as this are going to be the future of healthcare. And this work wouldn't have been possible without a huge number of collaborators, some of whom you can see on the slide. So I really wanted to say thank you to them, and to really say that I think we've only just touched the surface on what these technologies can provide. Thank you for listening.